So as someone who speaks with elderly people pretty much every day at work, the early signs of aging that I notice have nothing to do with wrinkles or gray hair. There are things that you can see in your posture, your skin texture, your nails, your eyes, the shapes of your muscles, and your movement patterns. Some of them are expected, some of them are subtle, and some will probably surprising. But what they all have in common is this: the windows into what's happening inside your body. Things like muscle loss, vascular aging, insulin resistance, and nervous system decline. And Dr. Alex, and over the last 10 years working in emergency medicine, I've become quite obsessed with the patterns and the numbers associated with living longer and staying in great health. I want to share his in growth with getting healthy years and hopefully teach you something instead, our doctor, so he does time to explain. Now, what I'm about to share with you isn't a cosmetic checklist. These are biological markers, things that reflect what's going on beneath the surface. And the reason I think this matters is because most people are aging happening to already well underway. But if you know to for, you could start addressing it decades earlier. But all this is something that most doctors tend to notice before most of the people do, and that is shrinking carved muscle size. So when I see a patient walk into the department, I'm not looking at their face first. I'm often looking at their legs and how they walk. And one of the earlier signs of biological aging is when the lower leg starts to lose muscle mass, especially around the calf. And here's why this matters. Your calf muscles literally acts like a bit of a peripheral heart. They pump blood back from your legs to your central circulation. When those muscles shrink, that pump becomes less effective. Blood pools more easily, circulation slows down, and the metabolic demand on your heart increases. Whereas not just domestic circulation, loss of calf muscle is one of the strongest predictors of frailty, of insulin resistance, and even mortality. Now, visually, you'll notice less become narrower above the ankles, almost spindle-shaped, and the mechanism behind is pretty straightforward. As we age, it could we lose muscle fibers, and the muscle lose is often ways at least, like cards, especially people who sit missing. The result is a metabolic fall down, you'll be straight and forward. In fact, if out of tapping, source is not enough us to say con. Moving on to number 2, which is forward head posture and a hunched upper back. Now, this is one of those signs that people dismiss as just looking old or just getting old, but is actually a reflection of deep structural changes. What happens is that the cervical spine, the bones in your neck, they start drifting forwards. At the same time, the upper back curves more than it should, creating what's called a thoracic kyphosis. Now, this isn't just a postural habit. It's the result of years of muscle imbalance, of weakening of the deep neck flexes, and often decades of desk or phone use. The head, which weighs around 10 to 12 pounds, starts to sit forward of the shoulders, and every inch forward increases the load on the neck by another 10 pounds. The consequences go beyond aesthetics. Forward head posture is associated with chronic pain, increased falls risk, and even breathing limitations because the rib cage can't expand properly. And from a doctor's perspective, this is one of those things that signals a decline in overall functional capacity. It's not particularly dramatic, but is measurable, is modifiable. For something that most people would pardon think about, and this is loss of the visible shoulder skin. If you could summon shoulders from the side, you think a rounded contour. That's the deltoid muscle. But as people age, that roundness starts to flatten arms. The arms look less defined, and the shoulder itself appears narrower. This is what we call deltoid atrophy, and it's one of the strongest predictors of overall muscle reserve. What's really interesting is that this often appears before people notice any functional weakness. They can still lift things, they can still move their arms, but the muscle is quietly disappearing. And because the deltoid is such a visible muscle, it acts as a marker for what's likely happening throughout the rest of the body. If the show is the shrinking, then the bod, the lod, and the core, they are too. As you move into the four, talking, your veins becoming more point, and the hands and forearms. Now, this isn't the same as fit veins. The kind is athletes or bodybuild will lay body fan. This is different. This is a consequence of skin thinning and lots of subcutaneous fat, which is the cushioning layer beneath the skin. What's happening beneath the surface is that your collagen is degrading slowly. As we age, the skin loses its structural support, the dermis becomes thinner, and the fat layer that used to sit between the skin and the veins gradually disappears. And the result is that the veins, which were always there, they just become more visible. And this isn't just cosmetic, it's part of a broader pattern of vascular aging. The walls of the blood vessels themselves are becoming stiffer, less elastic, and more prone to thinning. So when you see prone veins on aging hand, you're not just seeing the surface. You're seeing a marker of biological age that runs deeper than chronological is. Now, number 5 builds on that same theme, which is skin becoming translucent and papering, especially on the hands and the forearms. Now, if you've ever looked at the back of an older person's hand, just imagine your grandma or your granddad and noticed that the skin looks almost see-through. You're seeing lots of dermal thickening in real time. This skin, as you probably know, is made of multiple layers, and the middle layer is the dermis, is where most of the structural proteins live. Things like collagen, elastin, and fibroblasts, they all work together to keep this skin thick, resilient, and elastic. But as we age, fibroblast activity slows down, collagen production stops, the skin literally becomes thinner. And especially this chain is strong to bilaterally rather than corduroys. Two people who both 60 can have vastly different skin quality depending on some exposure, smoking history, diet, genetics. What this means is that papery skin isn't just about aging, it's about how you've aged. And that distinction matters because it suggests that much of this, to a point, is within your control. Number 6 is one of the most metabolically significant signs on the list. A widened waist with relatively thin limbs. Now, it will sometimes call this skinny fat finity, and it's a hallmark of insults. And what's happening with people age, particularly the thin tree, they leave muscle from the arms and the legs, peripheral muscles. It's in time the Achilles around the arm, particularly vessel found, which wraps around into organs. The result is someone who might have a normal BMI, but whose body composition is high risk. They look slim, metabolically, they're troll. Now, this pattern is strongly associated with cardiovascular disease and early mortality. And the reason is someone sees if a flies under the radar. People think of weight because they're not. They have any usual sins. Flat distribution matters just as much as total fans. And central fans is the most dangerous kind. Moving on to number 7, which is a slower walking speed. Now, this one is really subtle, and I mentioned this in a previous video really early on, and it got a bit of pushback. But it's one of the strongest predictors of lifespan that we have. In fact, walking speed is sometimes called the 6th vital sign because it reflects so many systems at once. Nervous system, muscle strength, joint health, cardiovascular, and cognitive function. Or as people age, they tend to walk more slowly. It's dramatic. It's not something they notice overnight, but over years, the pace slows down, the stride shortens, and the body starts to move with less confidence. And doctors notice this within seconds as we watch you walk into the room. We don't need a test. We just watch someone walk down the hallway or walk across the car park, and we can make a fairly accurate prediction about their overall health. The thing is, speed isn't as a consequence of aging, it's a dry health. So it can mean less cardiovascular demand, less muscle engagement, and less nervous system stimulation. It becomes this is cycle. The slow you walk, the weak you get. The weak you get, the slow you walk. New mate is something that most people attribute to your skin, but it's actually about muscle, which is reduced facial muscle tone. I'm not talking about wrinkles, I'm talking about the flattening of the cheeks, the loss of the jaw and definition, and the general cycle that happens not because the skin has stretched, but because the muscle beneath it has weakened. Its faith is made of dozens of small muscles, shape, expression. As those muscles atrophy or waste away, the skin draped over them loses support. The face becomes less structured to us to find. And some positives then is the aging is muscle less fast. Skin taint is always second. Most of the visible aging that we see in the face is driven by what's happening underneath, not on the surface. This is why fillers and skin treatments only go so far. If the underlying structure is collapsing, not a surface intervention will restore the original contour. Moving to benign the width and we're talking about changes in the hems. Specifically, what's a plumpness, tendon becoming more visible on the adrenal thing of the surfacing. Now, if you compare a young hand to an older hand, the difference isn't just skin, it's value. The hands of a younger person are fullest to them. A pattern it comes from muscle, fat, and connective tissue. As we age, the padding starts to disappear. The tendon on the back of the hand become porned, the bones become more visible, and functionally, grip strength declines. Now, grip strength, it might sound trivial, but is actually one of the most powerful longevity marks that we have. We colleagues with muscle mass, cardiovascular function, mortality. A weak handshake is just a social outcomes. It might go signal. House is something adaptable of the isthmus as normal, especially my variant is post-meal sleepiness. Events the vitamins later use as it. Now, most people assume this is just what happens after a big meal, that is normal, but in reality, it's often an early sign of interim resistance. And here's the mechanism. When you read the wish of the rises, in healthy metabolism, insulin is least, glucose is taken by your cells, and energy levels remain stable. When insulin resistant, glucose spiked higher than it should, and the body has released more and more insulin to bring that down. That reactive insulin surge can cause blood sugar to drop too quickly, leading to fatigue, brain fog, and that overwhelming need to nap. This is metabolic aging in action. It's not just about feeling tired, it's about how your body is handling fuel. And if it's happening after every meal, then it's worth paying attention to. Finally, number 11 on the list is lots of balance when standing still. Now, this is lots of those signals and things to sneak up on people. You're standing in line, you're waiting for a train or whatever, and you notice it can't stand on one leg for more than a few seconds without wobbling. Now, this reflects two different things. The first one is declining proprioception, which is your body's sense of where you are in space. And the second one is vestibular aging, which involves the inner ear and the balance systems. It's also a really strong predictor. It falls list of mortality. The inability to balance on one leg for at least 10 seconds, it really is associated with a significantly high risk of death within the next decade. What's happening is that the nervous system is simply slowing down. This simply slinging muscles, your joints, and your brain is becoming less slowies. And as the feedback weakens, so is your stability. Now, if you step back and look at all 11 of these signs together, they all point to three core pillars of visible aging, which is muscle loss, metabolic dysfunction, and your nervous system slowing down. Aging isn't simply cosmetic, it's physiological. For wrinkles in the gray hair, literally just a 5 days. The real aging is happening in the muscle, in metabolism of the brain. And here the portion for us. Every single one of these signs is modifiable. Muscle loss can absolutely be reversed with training. Metabolic function can be improved with nutrition and movement. Nervous system decline can be slowed down with bond training out of sleep and cognitive engagements. Mother at this song. The reason I want to make a video is because most people don't realize aging's happening until it's well advanced. If you know what to look for, you gain a huge advantage. You need to wait until you're 70 to start thinking about building muscle. You need to wait for a diagnosis to okay by your washer. You can act right now. Aging doesn't switch on later in life. It cools in very slowly. That gets on. And the thing's true, side down. The earlier you start, the more powerful effect.